Hello everybody, my name is Daniel Padmos and this is Dr. Shmuel Tatz, and we are body tuning and physical therapy. Today we're going to be talking about respiratory health as it relates to the corona infection going around, and we're also going to talk about lung health as it relates to everyday living. Okay? The first most important point to understand is that as we get older and our lungs become weaker, what's really going on is that we're losing elasticity inside of the rib cage and inside of the diaphragm and inside of the lung tissue itself. So our main goal today is to try to increase the flexibility of our lungs, both in the inhale capacity and the exhale capacity. Okay, and we're going to do this through a series of exercises. It's important to understand that while these exercises obviously cannot prevent some kind of viral infection, any increase to our health and resiliency inside of the body is going to mitigate any symptoms and reduce the time of the infection inside of our body.
First, show how to correct diaphragm breathing.
Okay.
How to work with diaphragm is what's most important. We sit and we put the hands in our stomach here, and you feel breathe in and breathe out, yeah. Pressing a little bit gentle. A little bit breathe in and be pressing out. And we staying each time a little bit longer, we staying with no air. And when we feel we want to take air, we taking, lifting the head a little bit and out, and you feel diaphragm going up. And we in a little bit, we can open even the ribs a little bit open, more open, between the air comes to the ribs, and out. And each time we trying to breathe out longer. This is number one. And now maybe when you lay down now.
Sure.
Okay. No, on your side, né?
Oh, like this
side. Yeah, okay. First we trying to breathe out, and a little bit in, lifting the ribs, pulling here, and breathe out. We think longer, and again breathe in and breathe out, slowly. In and out. Okay. And always good a little bit to move the shoulders. Yes, this is very close to the lungs, very important. And later a little bit, breathing out, big voice, little bit out. Yeah, careful, no pain, and again little, and in the end is very good if you take the elbow, we take the elbow, and a little bit breathe in, a little bit and out, breathe in, open the ribs, and breathe out. No air, don't breathe. And little bit in and out. Easy. Okay, to repeat how long? 5-10 times, and live long life.
Okay, what I'd like to share with you now is the Buteyko breathing method. And this method is a way to help reduce the residual volume of air in our lungs, which means that we're going to continuously exhale longer and longer and train our body to spend more time with less air inside of the lungs. Much like we started with the diaphragmatic breathing in, breathing out easy, letting the abdomen chase the diaphragm upwards. At the top of the exhale, we're going to wait before we breathe again. Okay, you're going to count maybe to 2 or 3 in the mind, and then breathe in again very easily. And this time you're going to count maybe to 3 or 4 in the mind. And this time you count maybe 4 or 5. And you repeat this over and over again, taking a small breath in, allowing the air to come out of the body effortlessly, and then resting at the bottom of no air in the lungs for a progressively longer and longer time period. Okay? When you get to something like 5 or 6 counts with no air, this is good. You can just repeat, repeat, repeat for up to 15 minutes if you can. This is ideal. Okay? The next exercise I'd like to share with you is directly related to creating a maximum expiration, getting all that residual air out of the lungs, which is the main risk factor in things like COPD, emphysema, basically almost any respiratory problem is related to not being able to clear the remaining air out of the lungs and having stagnant air that can breed bacteria and infections inside of the lungs. So one of the easiest ways to get the air out of the lungs is to use the human voice. So much like you saw, I was exhaling as Dr. Tatz was pushing my ribs to make the exhale. As I vocalize, this helps push the air out of my lungs to the deepest possible level. So the simple exercise will be used for counting. Okay, we're going to use counting to do the exercise. And it works like this. You count 10 counts out loud, and then you go to a whisper voice. And you continue to count in a whisper until you have no voice left. And you will feel the body struggle to get the last few words out, and then you will inhale as you need. Okay, it will look like this. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. When we use the voice in this capacity through the whisper, we ensure that the body's neurological system uses the diaphragm and ribs in the correct fashion. You will use the lungs correctly when you're speaking. So by extending your speech, you will extend the healthy use of the diaphragm.
And this is, you see, this is good for young people and for not so young people. And it is good to do at home, and even better to walk in the park early in the morning when sun is still shining, anytime in any place.
That's right. You don't really have to vocalize terribly loudly to do this. You can do this with nobody knowing. But you must speak a little bit in the mouth. And you're going to feel how the air comes out. I feel to be home alone, isolated, is making people they're going to get all kinds of other sickness now.
Sure.
Now people sitting forever at home, isolated, afraid to go outside. This makes like fear chemicals in the body, and you sitting and gaining weight without the usual walking and exercise. This time more than any other time, it's important to take care of the body at home.
Yes.
Because now you're at home all day. So.
Exactly. At the home we can do everything in home. In one room we only open the window, a little bit fresh air, and we can do everything. And we can move any part of the body we can move. We don't need weight training. We don't need mat on the floor. We can sit position, stay position. We can do, and this is now when we're sitting at the home, and we don't going to theater, and we don't go to museums. This is the best time right now to tune the body. God going to help us if we're doing something, but if only we're sitting and watching TV, the bad news.
Terrible news.
Is how we can feel better. But if we breathe, we clean the lungs, we make the lungs stronger. As everything bad, what's coming in the lungs, If you're going to out